here's the challenges we've come across in the past. You've heard me say this 100 times. What is Rhyno Healthcare Solutions? We're an applications company. But how come you spend all your time doing infrastructure projects? Because we're an applications company. It's kind of funny. We're brought in because we look at things differently than infrastructure. I love our infrastructure partners. They do amazing things, but they look at things as boxes and technology. They don't look at what's running on it. They don't look at the impact to the business necessarily, and they don't understand all the reasons to decide when is downtime acceptable. How do you manage the daily versus the weekly versus a monthly workload? As I said, that's our bread and butter. But when you go into data center consolidation projects, for example, it seems like it makes perfect sense. We're going to take two data centers that exist and we're going to merge them down into one. We're going to improve our footprint because we're going to go with more powerful equipment and with the smaller footprint, smaller power consumption, all that. And so one of the things that we came up with was one of our customers had one data center that was really the production data center, and one data center that really ran their lower regions, their testing systems. And in some ways, that physicality worked because if you needed to do things, you can do things on the lower regions in one time and then prod on another. And then you go, okay, we're going to consolidate that together. And all of a sudden, you're putting everything into one data center. Well, now you've just complicated your DR strategies, perhaps, because you can't split things across data centers anymore. And that's what we found in some organizations, that they move things to a consolidated data center. And then what it did is it put more reliance on their disaster recovery data center. So there were certain things, for example, that didn't have a good DR strategy. So they ran in what would fall a co-location. They had one running here, one running there. God forbid this one went down, they had this one. That was their DR strategy. Well, all of a sudden you merge the two data centers together, that DR strategy goes away. So what are you going to do? So it was really interesting when we did some consolidation work that you had to take into account. Yes, we're doing it for the right reasons. There's going to be cost reduction. It's going to be easier to manage in certain ways. But what's the long-term effect in some of the other strategies like disaster recovery and cybersecurity and all those things?